So thank you very much. Welcome to Houston. I had a special course on how to use this clicker, so it's ironic that... Okay, so these are our disclosures. So goals. So we, as Neil and Justin mentioned, we kind of have this session kind of divided. So me and then the few individuals who follow my talk, we're going to talk about specifically teaching trainees, so teaching fellows, residents, med students in the operating room. So we're going to introduce you to this kind of overall conceptual framework, which we're calling the BID, based on some work out of with Reed Williams and some of the folks at SIU and then IU who've created this kind of conceptual model of briefing, interoperative teaching, and debriefing, and kind of breaking it into those three steps. We're going to introduce you to this model. We're going to talk about kind of this conceptual components and foundations behind the model, and then we're going to let you have an opportunity to apply this framework with some fun sessions. So let me just ask you, I will ask a question, and you will respond. Tell me why you're here. Why did y'all sign up for this course? This is a Friday afternoon about teaching, education. There's lots of fun other things going on. So tell me what you want to get out of this course. Just a couple of... Ganesh, why are you here? Gotcha. So you design curricula, simulation type learning opportunities. You want to be able to maximize those encounters. Gotcha. Perfect. What about a surgeon? Is there a surgeon out there? Yep. Good. Thank you for sharing. So good. So I hope we're able to meet both your goals and then everyone else's as well. So let me just give you a little bit of background. So at the time that this course was put together, there were about 35 or so kind of peer-reviewed articles that look at interoperative teaching, but specifically faculty teaching, kind of a resident fellow in the operating room. And my team kind of did a systematic review and sorted through all of this. And as you might imagine, there were surveys of what do learners want, what do faculty say they're doing. There are kind of just perceptions of what we think should be doing. There are all sorts of kind of little interventions here and there of let's give a feedback tool and see if that helps. And so we were able to sort through all of this and kind of put them into three different kind of topics. So there are a lot of opinions about what should happen in the OR. So a lot of the work was actually just perceptions and best practices, kind of conceptual type things and frameworks. There were a lot of survey-based literature of what do the residents say is happening, what do the faculty say is happening, et cetera. And then there were really less than a handful of actual interventions that kind of had some data showing, well, if you do this, this helps people learn. This helps someone teach. It really is able to optimize this educational environment. So this is kind of the foundation for this course, and we've pulled in things from everywhere. So we've pulled in stuff from LabCo TT course that Sage has been really involved with. We've pulled it from simulation-based courses. We pulled in some stuff from business world about managing conflict and difficult debriefing strategies, et cetera. So we've kind of tried to pull in things from this kind of systematic review, but also everywhere, of just a smattering of taking the best and brightest. So this is kind of the backbone. And best things come in three. I am the third child, so I'm mildly biased, but we've kind of broken it down along some of these conceptual models of three phases of intraoperative instruction. So I'm going to talk a little bit specifically about the first, and it's this kind of pre-brief, this discussion that you have with a trainee before you actually start the case of, what are our goals? So what are we doing on this procedure? What are we doing today? Just kind of getting that out of the way. Talking about previous experiences. So asking your trainee, have you done this case before? How did that go? Tell me about it. It's also important that you're sharing your experiences. So maybe you're using new technology, you're using a new technique. That's the time where you tell your trainee, okay, so I'm not super comfortable with this technology yet, so just so you know. So it's just kind of getting everyone on the same page. And then focusing on just one or two, and that's really specific, and Dr. Duncan will talk a little bit about kind of the conceptual part of that too, but really picking one or two specific learning objectives and goals for that case with your trainee that you're going to be working on and talking about after, and then aligning agendas. And that can be anywhere from developing some common language, or telling them, when I say up, that means instrument up, or that means hand up. Telling them, what your mm-hms and mm-ms mean, etc. I know you all have very different languages and styles of teaching. So this is just the conversation of, when I say this, this is what I mean. If I say this, don't freak out, do this, etc. So this is the pre-brief. Then there's the intraoperative teaching, and then there's the debrief. So this is the whole background and kind of conceptual background for this whole first part of the course for teaching trainees. So if you take one thing away, take a picture of that. We'll actually give you a little souvenir before you leave that has this printed on it as well. But this is it. This is the whole thing. So if you need to leave now, that's fine, because here it is. But One thing that kind of based on my experiences with when I was at UT Southwestern, we developed this kind of interoperative teaching course, a little half-day course, kind of based on a lot of these other paradigms that I mentioned. And the biggest thing that we had, where we spent a lot of our discussion, was on this goal refinement, this establishing 1 or 2 learning objectives with trainees. So that's something that if you take home anything kind of about this pre-brief, it's goal setting. Goal setting is important. We know when people have goals, and whatever setting it is, your personal health, your own performance, your professional development, that people perform better. So it's important with the trainees that you're also setting these goals. So let's get a little interactive and talk about some goals. So you've probably seen this idea, this kind of SMART goals before, of helping develop nice goals that are specific. So a resident walks in and says, hey, I want to learn this procedure, then it's your role to get a little bit more specific and kind of refine that goal of, okay, well, let's talk about, you want to do a safe procedure. Let's talk about what that means. It needs to be measurable. So obviously you need to have some metric where you can actually track progress. So when you create that goal, you put in some kind of measurable component so that that will be fodder for, your feedback debriefing conversation. Agreed upon. So again, talking with the trainee and setting those 1 or 2 kind of goals for the course. Realistic. So within this procedure, within this time frame, is that a realistic goal? Trainees may want to do the whole case themselves, and you may have to kind of hone them in a little bit and say, well, let's talk about that. Let's focus on this part of the procedure. And then there needs to be a temporal component as well. By in the next 30 minutes, by the end of this procedure, by the time you leave my rotation, I want you to be able to do these things, etc. So just a little nice something to put in your pocket, SMART goals. So here's some goals that have been given to me by your fellow surgeons of common goals that trainees tell them. I want to get better at a lap chole. So again, this is an interactive session. So if someone walked into your OR and you said, hey, what do you want to do today? We're working on this case. And they said, well, I want to get better at a lap chole. What might be some follow-up questions you would ask to help them kind of narrow in that goal? Yes, Dr. Stefanos. How to spell it? Okay, good. How many have you done? What else? What do you mean by getting better? Good. What's the anatomy? Good. So you are very talented already. Good. So you're just refining these goals. What if they say, I want to know the anatomy? Dr. Gardner walks in your OR, which is always a bit scary, but Dr. Gardner walks in your OR and I say, hey, I want to know the anatomy on this case. What would you say to me as a faculty surgeon? What have you read so far? So getting those previous experiences, knowledge, right? Describe. Yeah. Anything else? How about you narrow this down a little bit? Okay. Good. Show me. Good. What about this? I want to get familiar with the instruments. What instruments? I have a feeling Dr. Stefanidis' OR is fun. Anything else? I want to get familiar with the instruments. Have you used them in the past? What have you used in the past? Good. What has caused you challenges? Okay. What about the next one? I want to be able to do more of the case. Dr. Korndorfer, I want to be able to do more of the case. Go to Dr. Stefanidis' OR. Dictate it. I want to be able to do more of the case. Okay, that's a good one. What have you done? Yeah, perfect. What have you done so far? Talk me through the case. Good. Which steps? What about, I just want to avoid complications. A trainee tells you, I want to avoid complications. I'm sorry? What are the, yes. Perfect. Perfect. Good. So thank you. I'm skipping through those because those should be at the end of this slide deck. Now I'm going to turn it over to Dr. Duncan, who's going to talk to us a little bit more about the specific intraoperative teaching.